Ontology to tell us more about the built environment, both the residential and community. Janice.
Thanks very much. I'll frame this discussion around in universal design of dementia-friendly care settings in terms of the person-environment fit, recognizing that accessibility and environmental sustainability are both important. So, I have to turn this, don't I? Okay. So I'm going to start just by showing you the ecological theory of aging, or environmental press. And this is a theory that'll be well known to many of you from Lawton and Nemo, which is operationalized as the outcome of the transaction or interaction between the person and the environment. So the optimal fit occurs, should have typed this, yes. The optimal fit occurs when someone's capacities are consistent with the demands and opportunities within that person's environment. Well, it's not specifically designed for persons with dementia or cognitive impairment. It does provide us a tool that can be used to acknowledge and to respond to the heterogeneity of the competencies within dementia, so we can understand that there's a range of different competencies. One of the challenges, though, some of our long-term care facilities often maintain this approach as a much more heterogeneity process. So I'm going to talk to you in my presentation about 3 projects. 2 are physical environmental design, and 1 on the physical location of care facilities or care activities. And I want to first talk about physical design in the built environment of the nursing home, in terms of a study that we did in Nova Scotia, and also in terms of in the community, in terms of the access and the accessibility of adult day programs. So in terms of Nova Scotia, we had a project called Care and Construction. It was facility based on the idea that facilities were undergoing cultural changes, different new innovative physical designs, changes in the staffing approach you heard about earlier, and a real focus on resident or relational-based care. We were funded by CIHR, and we included 23 different facilities and a range of different perspectives from the resident, the family member, and the staff. So our research question was to ask what extent and what ways do differences in the nursing home model of care impact on residents' quality of life. And one of those aspects was, in fact, the physical environment. So what we did was we looked at residents' quality of life from the perspective of residents, staff, and family. And one of the similarities that have emerged across all of the different multi-level model of care is, first of all, home likeness appeared to influence resident quality of life in all 3 perspectives, as well as relationships. So for the resident, it was the personal relationships that they had, and the relationships, the bonding that they had with staff in the facility. For the family, it was their relationship between themselves and staff members, and respect that they gained. And for the resident, and also that residents were able to have relationships with other residents. And for the staff, there was the staff to resident relationship as well. So while we thought that our model of care was going to, in fact, influence resident quality of life, when we included the other levels of characteristics in our model, we found that it was between this relationship and home likeness, so that the model of care, or the physical design and the staffing model, worked to help develop these better relationships and home likeness to enable better resident quality of care. When we looked at the family, this was certainly more about the physical space, while for the resident and the staff, it was much more likely to be about the relationships. We also looked at care environments for community-based agencies. So how dementia-friendly are community-based environments such as adult day programs for persons living with dementia. And this was what work done with a graduate student who, through the literature, came up with 9 different criteria on which environments should be based in order to be dementia-friendly. The survey results in Nova Scotia suggested that significant challenges occurred in our province in terms of the environmental suitability based on those 9 criteria. So many of the facilities which house the adult day programs were in fact not necessarily suitable for persons with dementia. In the basement of churches, in some of the corners of large community care centers and so on, which really had some difficulty for the individual. So we need to recognize the flexibility in terms of the need for more and improved community care options that integrate the agency of the person living with dementia. And so that these physical spaces as well need to anticipate and adjust to that diversity of the person living in this space. So finally, I want to talk about an emerging issue where care homes are geographically located, and think about moving beyond just space, but to where older people with dementia, including care facilities, are actually located. So in this is a study done, of course, in Nova Scotia, because it's looking at some of the climate change coastal impact and the relationship between coastal climate impact, aging population projections, and the infrastructures and services that are important for older people. So in this study, we combine population projections and infrastructure data sets with expected sea level rises and storm surges to the year 2025. And what we found was we revealed this vulnerability of some of the emerging populations of older people, particularly in this area, which is Lunenburg County. So those of you who know beautiful Nova Scotia, beautiful Lunenburg County, well, one of the challenges is it's very beautiful, but for those of you who might have a summer home there, please put it back from the coast, or it's not going to be there when the storm rolls in, the hurricane season, which was currently now upon us. So what we realized is that in this scenario, in fact, some of the individuals, and the map shows the orange area, is the proportion of people age 65 and older who are at risk of flooding because of storm surges by 2026. So finally, I want to say that the slides that I've been referencing in the presentation illustrate the importance of recognizing the role that care environments can play in disabling as well as enabling the older person with dementia to have a good quality of life. So I'm basically trying to think about this across 2 registers, that there's a relationship between how a space is structured and what happens in that space, and that's a consequence of the space's capacity or the facility's capacity to anticipate and be able to adjust to the diversity of the people who go through that space, as well as recognize the relationship between space and place. So we've identified some of the positive solutions in creating physical spaces that promote interactions, depict comfort and flexibility and familiarity, and enable relationships to occur, all that improve the quality of life of older people. But we are reminded that flexibility is key, that adaptations that work for some may be disabling for others. We know that endurance is key, that we need to look at both space and place. We've heard from Verena that simplicity is key, from Alex that technology is key, and from Pat that enabling some risk is also key. So what I believe is what is dementia friendly in terms of the built environment is also people friendly. Thank you.